Well, a local health expert's advising COVID-positive patients to seek professional treatment instead of staying at home. Jiminita Swain explains.
To go to hospital or not? The question some COVID-positive sufferers may ask themselves. However, infectious disease specialist Dr. Nakia Forbes paints a clear picture of what symptoms should prompt one to seek help from professionals.
That if you are having severe symptoms, like shortness of breath, lightheadedness, chest pain, dizziness, for example, we consider those symptoms of people who are generally unstable. And you do need to get professional medical advice. And you may warrant an assessment. And you should go because if you are that sick, then you will be accommodated. It is a difficult time, but that is the safest thing to do. It is definitely bad for you to take that in your own hands and decide to stay at home because you run the risk of dying at home. And that is happening in the COVID pandemic worldwide and here at home.
That's in the case of critical patients. For those with mild symptoms,
flu-like symptoms, like fever that's not too high, that would be under 100.4 degrees, and it's intermittent, it's not constant. It could be headache, you could feel tired, you could have some chills, muscle aches, or joint pains, for example, and maybe even joint pain. You could have belly pain, some nausea.
Now, in the event of shortness of breath, the health expert says here's what it could be triggering.
Because you may be getting a pneumonia and you may need to have in-hospital or a in-specialist or a COVID site in inpatient management. So people who do not have difficulty breathing and who have just mild flu-like symptoms, they can absolutely have care at home. For example, you can take vitamins, multivitamins, vitamin C, vitamin D, zinc. That can be helpful. You're going to make sure that you continue to drink a lot of fluids.
What she discourages was the use of ivermectin for COVID care.
That drug is not approved for the use of COVID-19. As a matter of fact, it could be quite dangerous. And there have been reports of the increase of utilization of this drug and people having toxicity and hospital admissions and bad outcomes because of it. So please, that is not what should be used. There is standardized care guidelines for these medicines.
Jiminita Swain, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage,